Welcome to part 3 of nursing practice questions and answers about musculoskeletal problems of the adult gland. Now let's start with the first question. A client has sustained a closed fracture and has just had a cast applied to the affected arm. The client is complaining of intense pain. The nurse elevates the limb, applies an ice bag, and administer an analgesic with little relief. Which problem may be causing this pain? So these are the options. Option A, infection under the cast. Option B, the anxiety of the client. Option C, impaired tissue perfusion. Option D, the reason or occurrence of the fracture. Now, for this question, the correct answer is option C, impaired tissue perfusion. Now, let's move to the rationale. Most pain associated with fractures can be minimized with rest, elevation, application of cold, and administration of analgesics. Pain that is not relieved by these measures need to be reported to the primary healthcare provider because pain unrelieved by medications and other measures may indicate neurovascular compromise. Because this is a new closed fracture and cast, infection will not have had time to set in. Intense pain after casting is normally not associated with the anxiety or the recent occurrence of the injury. Finally, treatment following the fracture should assist in relieving the pain associated with the injury. Now let's move to the second question. The nurse is admitting a client with multiple trauma injuries to the nursing unit. The client has a leg fracture and had a plaster cast applied. Which position would be best for the casted leg? So these are the options. Option A, elevated for 3 hours, then flat for 1 hour. Option B, flat for 3 hours, then elevated for 1 hour. Option C, flat for 12 hours, then elevated for 12 hours. Option D. The correct answer for this question is option D, elevated on pillows continuously for 24 to 48 hours. Now let's move to the rationale. A casted extremity is elevated continuously for the first 24 to 48 hours to minimize swelling and promote venous drainage. Options A, B, and C are incorrect. Now let's move to the third question. A client is being discharged to home after application of a plaster leg cast. Which statement indicates that the client understands proper care of the cast? So these are the options. Option A, I need to avoid getting the cast wet. Option B, I need to cover the casted leg with the warm blankets. Option C, I need to use my fingertips to lift and move my leg. Option D, I need to use something like a padded coat hanger end to scratch under the cast if it itches. So for this question, the correct answer is option A. I need to avoid getting the cast wet. Now let's move to the rationale. A plaster cast must remain dry to keep its strength. The cast needs to be handled with the palms of the hands, not the fingertips, until fully dry. Air needs to circulate freely around the cast to help it dry. The cast also gives off heat as it dries. The client will never scratch under the cast because of the risk of altered skin integrity. The client may use a hair dryer on the cool setting to relieve an itch. Now, in my presentation, my reference book have used Saunders Comphrensive Review for the NCLEX-RN Examination 9th edition.